This is Dr. Soumya Parimi. I'm a pulmonologist, and I'm here today on World No Tobacco Day to talk about the impact of tobacco in our communities and also some thoughts on cessation, as in how to stop using tobacco. Yeah. So first, let's talk about the prevalence of tobacco product use in the country, in India. Surprisingly, 40% of adults in India, 40% of people in India use tobacco products in one form or another. That may be smoking, which includes cigarettes, BDs, cigars, etc. 14% of adults use inhaled tobacco products. 24% of men use them. But more surprisingly, a large percentage of Indians, in fact, the largest number in the world, use smokeless tobacco, as in chewable and other tobacco products. So 200 million, in other words, 20 crore Indians use smokeless tobacco products, 25% of adults. So this is a bigger problem compared to the rest of the world. So why do people smoke? We talk about the harmful effects, etc., but there is a reason why so many people reach for it. It gives you that good feeling, especially nicotine. So nicotine creates a mood boost, increased alertness. Patients tell me it helps them focus. So those are the things, the chemical reactions in our brain that make us use nicotine products. But it's also addictive, both physically and mentally, psychologically addictive. And addiction is a bigger problem when people start using it at a younger age because of the chemical effects on a younger brain. So, what are the effects in the body, the physical effects of nicotine? So, after smoking a cigarette, your blood pressure goes up 5 to 10 points on average. Your pulse goes up 10 to 20 points. It causes the blood vessels around your heart that supply blood to your heart to narrow. Therefore, less blood supply is going to the heart muscle. It increases your blood's natural ability to clot. So your blood has a normal ability to clot, but that becomes overactive with cigarettes in your bloodstream or tobacco in your bloodstream. And it also adversely affects your cholesterol and lipid levels. So the normal balance of cholesterol and lipids in your blood is disturbed. When you look at all these factors, it's no surprise that nicotine is a huge, or tobacco is a huge risk factor in coronary disease or heart attacks and can lead to heart attacks. So going on to the diseases, as we just talked about the health effects, the cardiac health effects, the biggest killer of people in India, the biggest cause of mortality, cause of death in India is heart attacks or heart disease or cardiovascular disease. And as you just saw, tobacco products significantly increase your risk of having a cardiovascular event, be it a heart attack or a stroke or lung disease. Chronic obstructive pulmonary disease or COPD is a lung disease that is predominantly caused by inhaling cigarette smoke. It damages the lining of the breathing tubes in your lungs to the extent that you have trouble breathing. And also, chronic bronchitis is another word for lung disease caused by tobacco product use, leading to chronic cough, productive of sputum or phlegm. And of course, the dreaded cancer of multiple body parts, not just the lung, but head and neck cancer, especially with smokeless tobacco products, head and neck cancer, and also colon cancer risk is increased. In pregnancy, use of tobacco products can lead to inhibiting the growth of the fetus. The growth of the baby is reduced, leading to preterm birth, small weight, and of course, secondhand smoke is a big risk, whether in children or other adults. It increases risk of lung disease and cancers. Especially in children, it is a big cause of asthma and other frequent respiratory infections, ear infections. All that risk is increased by being exposed to secondhand smoke. So we just talked about all the harms. What about the benefit? A lot of people think, I've been smoking for so long, the harm is done. What's the point now in stopping smoking? Well, there are a lot of positive effects, which this slide tries to summarize. Some occur very quickly within minutes, and some take many years, but there's still improvement happening every day after you've smoked your last cigarette. So within 20 minutes, your blood pressure and your pulse will return to normal. Within hours, the level of carbon monoxide, which is a toxic gas that is created by inhaling cigarettes, smoke, that gas returns to normal. And over time, your sense of smell and taste over a few days returns to normal. Your blood circulation, your cardiac circulation, your cough, wheezing, breathing problems, all of these improve over weeks to months. And over anywhere from 1 year to 15 years, as you can see on these slides, your risk of having a heart attack, your risk of stroke, your risk of lung cancer, all of these risks gradually decrease over a period of years after stopping smoking, so that after a few years your risk is almost the same as a non-smoker, which is something positive. So quit it. It's easier said than done, right? It's easy for someone to say just quit smoking. It's harder to actually do it. So what's the necessary components for somebody to successfully quit using tobacco products? The step one is somebody has to want to quit. Somebody has to believe that that's good for their health or necessary. And that's the biggest component. It's not my wife wants me to quit, my daughter wants me to quit. It is, I believe this is good for me. The next thing, your doctor saying something to you, anything, even if it's one sentence or a 5-minute talk about the benefits of quitting cigarettes for your health, has a big component, has a big part to play. There are studies that show that even a few minutes spent by your doctor talking to you about quitting smoking and the benefits can increase the successful quit rates among smokers or tobacco users by many percentage points. We're talking 20 to 50% increased chance of success if somebody says something to you, your doctor says something to you. Find support. This is not the kind of thing that you want to do by yourself. Just pick a date and secretly quit. You could do that, but your chances of success are significantly increased if you find support from the healthcare community. So your doctor, counselor, etc., from your friends and family, telling them that you have a plan, that you want to quit, and asking for their support, whether it's that person you call when you feel an urge to smoke a cigarette or somebody you want to talk to support you when you're having a difficult time with it. It helps to have support. So what are your options? What are the support tools available for you to quit smoking? The first and foremost is behavioral therapy or counseling. In part, this can be done by your doctor, but there are also certified counselors who can support you through the entire process. Nicotine replacement therapy. This comes in many forms, including nicotine patches, gum, lozenges, etc. This is something I would strongly advise using under the supervision or advice of a doctor and not going to a pharmacy buying something yourself and just starting them. Because, like any medication, this can have side effects, and it would be best if you took things in the right dose with the right level of preparedness for the potential side effects. And finally, there are medications. There are a couple of approved medications that have been proven to help with quitting smoking. So make a plan. Step one is deciding that you want to quit. Step two is picking a quit date. So a quit date doesn't have to be today, it doesn't have to be tomorrow. It can be next week, it can be your birthday, it can be your son's birthday, it can be your mother's birthday, or it can be any day you want. It can be Tuesday. Pick a quit date and make a plan to move forward. So prepare for that date. Tell the people around you, tell the people you live with, tell the people you work with, talk to your doctor. Get rid of your paraphernalia. So your packs of cigarettes, your ashtrays, your etc., that backup pack in your bathroom, everything. Just get rid of it. Don't save anything just in case. And then think about how are you going to handle cravings. Craving is that urge that you need a cigarette that comes up once you quit smoking, and that happens because of nicotine withdrawal, both physical and psychological. So be prepared, and what are you going to do when you feel like you need a cigarette? So what to do when you have a craving? Make a list. What are you going to do when you feel craving? Whatever you're doing, if you're sitting in front of the laptop working, stop doing it. Get up, go for a short walk, even if it's walking around your home, walking around your office, or even better, walking outside where you're not allowed to smoke in public spaces. Take a short walk. Pop some gum, regular gum or hard candy. Surprisingly, this can help. Sometimes it's a very act of doing something, drinking a glass of water, having any kind of gum in your mouth, taking a walk, a distraction, and the craving can pass in a few minutes. And then have a buddy, somebody you call when you want to be distracted from this, whether it's someone you decide to quit with together or somebody who doesn't smoke, who just is going to give you that little 5-minute pep talk that you need to get distracted from this and move on with your day. So there is obviously the option of using a short-acting nicotine replacement, as in a gum or a lozenge. And I say short-acting because it gets in your system quickly and lasts for a short while, just as a cigarette would, and provide you that nicotine that takes the edge off your craving. So nicotine replacement, what are your options? So long-acting patches last for 24 hours. So you put a patch on, it works until the next day, the same time. And this prevents cravings, as in it slowly releases a low amount of nicotine into your blood continuously so that you don't feel like you are withdrawing from nicotine. Short acting, that is gum or lozenges. So when you feel the craving in the moment, you can use that to take the edge off. So both of these usually work together. Depending on how much you smoke, how frequently you smoke, there is a right way to use these. And like I've said before, I would strongly encourage you to use this with the advice of a doctor and not just pick them up from pharmacies. This is not an advertisement. This is just so you know there is so much out there and you need the right guidance to choose the right product, which includes using the right dose of the patch along with the right dose of the gum or lozenge that could help you. And then finally, a quick word on medications. There are 2 approved medications on the market worldwide and in India called bupropion, which comes in multiple brands, and varenicline, also called Champix, which can assist with smoking cessation. Typically, these medicines are slowly increased in dosage to the therapeutic dose, taken for around 3 months. Like with any medicine, they have the potential for side effects, so it's best to go into this prepared and understanding the side effects, the risk, the benefit. A lot of times people have successfully quit without these medications. They've quit with behavioral therapy combined with nicotine replacement therapy. But it's good to know you have the option of taking medicines like this, typically for around 3 months to help you in the initial process. So that's what I have for you today. There is a national quit tobacco program and many other community resources. This is the website for India's quit tobacco program if you are looking for more information. Thank you for your attention.